Welcome to Pulse&Pressors, where critical care gets crystal clear. Today, we're focusing on pulmonary artery pressures, what they mean, how to interpret the numbers, and how this data guides patient management. Pulmonary artery pressure is more than a number. It's a window into right heart afterload, pulmonary circulation, and left heart function. Pulmonary artery pressure is the pressure within the pulmonary artery. Normal systolic pulmonary artery pressure is 15 to 30 millimeters of mercury, diastolic 4 to 12 millimeters of mercury, and mean pulmonary artery pressure between 10 and 20 millimeters of mercury. Pulmonary artery pressure reflects the afterload faced by the right ventricle and is directly influenced by pulmonary vascular resistance. Persistent elevation of mean pulmonary artery pressure above 20 millimeters of mercury defines pulmonary hypertension. Breaking pulmonary artery pressure into components. The systolic pulmonary artery pressure reflects right ventricular contraction and ejection. It rises with pulmonary hypertension, embolism, or increased resistance in the lungs. Diastolic pulmonary artery pressure reflects downstream tone and often correlates with left atrial pressure or wedge pressure. The mean pulmonary artery pressure is the average across the cardiac cycle, and it's the value we use when defining pulmonary hypertension. When pulmonary artery pressure is high, consider pulmonary hypertension, left-sided heart failure, ARDS, pulmonary embolism, or simple volume overload. When pulmonary artery pressure is low, the most common causes are hypovolemia, excessive vasodilation, or reduced right ventricular stroke volume. Pulmonary artery pressure should never be interpreted in isolation. Pair it with wedge pressure, cardiac output, and clinical exam findings for accuracy. To wrap up, pulmonary artery pressures give us insight into right heart afterload and the state of the pulmonary vasculature. Breaking pulmonary artery pressure into systolic, diastolic, and mean helps us pinpoint whether the issue is RV performance, pulmonary resistance, or left heart backup. Remember, pulmonary artery pressure is only one piece of the hemodynamic puzzle. Pair it with wedge pressure, cardiac output, and oxygen delivery data for the clearest clinical picture. That's Pulse&Pressors, providing a daily education on the marvels of the human body.